Hello, everyone. New York and several other states instituted COVID vaccination mandates for their healthcare workers in the past couple of weeks. And it has seen a good amount of news coverage, most of it bad, while others touting the necessity for vaccination amongst healthcare workers. I want to make one thing very, very clear to everyone watching. I do not give a fuck whether or not you personally choose to get the vaccine. That is none of my concern. My issue is with those who feel it necessary to compel others to get it. There are outstanding circumstances for many individuals that, whether or not you assume other people already get it when you say the word all, no. In fact, most people assume when you say all, you mean all. The original vaccine mandate for New York, as agreed upon in late August, did not include a religious exemption, for instance. With Vanessa Murphy, attorney for the New York Department of Health, saying, "We are not constitutionally required to provide a religious exemption." Yeah, screw off, lady. Honestly, government compelling anybody to violate their religious beliefs is most definitely codified in our First Amendment and applied to the states. So don't even start with that. In fact, in case anybody is curious as to how religion could block a vaccine, this article from Bloomberg gives a summary on how three workers just won in court, requiring New York to hold off on their tyranny of forcing people to get the jab, citing religious concern. The article says the New York healthcare workers said their faith prevents them from accepting any of the three major vaccines distributed in the U.S. because the drug companies behind them, quote, relied on use of fetal cell line harvested from aborted fetuses in the 1970s and 1980s. They said abortion violates their religious principles. So that's their assertion. I don't know if it's true. I'm not going to look it up for this video. I might later. Point is that at least what they are claiming, and if it is objectively and verifiably true, I understand why some would claim a religious exemption from such things. Not saying if it's right, just saying I get it. Moving right along, why is this even important? Why do I care if I said earlier I don't care if people get the vaccine? Well, it's because this required nurses, doctors, and long-term healthcare workers like nursing home employees as well to get a vaccine that they might object to. And if they do not, they can be fired from their job. Hundreds of healthcare workers across the country are being fired or suspended in droves for not complying with COVID-19 vaccine mandates. President Joe Biden announced earlier this month a vaccine mandate for healthcare facilities that receive Medicare and Medicaid reimbursement, impacting some 17 million healthcare workers in the nation. States including New York, California, Rhode Island, and Connecticut also set vaccine mandates for healthcare workers that take effect this week. But there are brewing concerns over staff shortages at already overburdened hospitals still grappling with COVID-19 cases. Some hospital networks say they've ramped up hiring ahead of vaccine deadlines to stabilize their workforces. Now, of course, this means that according to this article posted on September 30th, the hundreds mentioned are from individual locations. For example, North Carolina Novant Health System had about 175 fired. 375 were given a 5-day suspension pending their vaccination, of which 200 ended up complying by the end of the week. In Texas, 153 fired from Houston Medical, 150 left from Delaware's Christiana Care, and more listed in the article. But should you want to see hundreds that turn into a couple thousand, feel free to read the article. Now, of course, what would happen if you took a bunch of employees from a singular discipline? You start to get staffing shortages. The Guardian doesn't seem to be too concerned about it. Not only that, but apparently those who get fired for failure to get the vaccine are mostly now ineligible for unemployment benefits. Now let me rant for a second here. Do you guys remember last year? Our frontline workers, heroes they called them. In the UK, they clapped outside their houses just for the NHS. We celebrated heroes here in the US. I think we put up some billboards and I think we had some moments of consideration for them. They were put into situations where most of them likely contracted some form of COVID just based on the exposure to infected people, right? Now let's look at what we're telling them now. Bend the knee and obey our demands, or you shall be cast aside. Should the CDC be correct, and the health officials pushed on the media, should they all be correct, and COVID will continue to be around because of the unvaccinated people. What do you expect to happen? Well, there will be more people going to hospitals. And because they have taken away people from that workforce, expect staffing shortages and overcrowding. Now, what will they do? Well, they'll make the military take over. New York Governor Kathy Hochul is considering employing the National Guard and out of state medical workers to fill hospital staffing shortages, with tens of thousands of workers possibly losing their jobs for not meeting a Monday deadline for mandated COVID 19 vaccination. So picture this: your grandma has a fall, ambulance comes to get her, brings her to a hospital, but 22-year-old warrant officer Collins will be taking care of your grandma because there are two doctors to go around. How comfortable are you? Are you happy? You expect everything to go all right? I wouldn't be. I'd be livid. And consider this: if you think I'm out of line, if I'm full of shit, ask yourself, why not an antibody test? Why a vaccine and not an antibody test? Why not see if these people have natural immunity from previously having COVID? It's because they don't care. It's not about the function, it's about the control. But that's what I have for you guys. Like and share this video if you think it's worth it, and I will see you guys soon.